Hold on, we have to figure out a way.
Live.
Hi.
Welcome to Tea Time with Kitty. I'm just giving everyone a second to join on with us. As you can see here today, we have Dr. Tamika Greenwood, and our discussion today will be about health and well-being. So just give us a second. We're going to give it about 3 more minutes to allow a few more people to log on, and then we'll get started. Again, thank you so much, Tamika Greenwood, for Dr. Tamika Greenwood, for welcoming me first and foremost into your home, this beautiful office. And I just want to thank you for allowing yourself to be here with us today and giving us the time and to give us some more health education, because health education is so important. So I'm going to give it about 2 more minutes. So while we're waiting for others to join, Tamika, would you like to give us a little introduction about yourself?
So sure. I'm just gonna shut the door.
Okay. And I'm going to swap seats with you. Okay.
Sure.
Okay. So there we go. Got it. So okay. Okay, so you can see both of us.
Cool. Hey everyone. I'm Tamika Greenwood, and just a little bit of information about myself. I spent all my 20s in school. And I'm a clinical pharmacist. I currently work for the government, and I love my job. One of the reasons why I love my job is because I get to help people. And one of the reasons why I chose this field is because I wanted to understand medication, and my grandmother was a very big part of my life. And so she died at 54 years old from complications of diabetes. And so my specialties is diabetes. I make sure I educate people on diabetes. I know I get on most of my family members' nerves, but if I can educate you, and hello everyone. I know we see everyone saying hello.
Hello, everyone.
If I could just educate you, or even give you knowledge so you can educate the next person, especially those people who look like us, then I know that I'm making an impact, and at least we can save someone's grandmother. And so today I'm just going to give you brief information on just probably some complications and things that you can do to just kind of avoid or even prevent yourself from, or delay yourself from getting diabetes if it's a part of your family line. And so that's what we're going to kind of focus on today, as far as like health and wellness, and just taking care of yourself and making sure that you're doing certain things so that you could live a healthy, longer life, or even pass the information on to one of your family members.
Okay, so I have came up with a list of questions that I would like to ask Dr. Tamika Greenwood today. And if anyone have any questions that they want to ask, please feel free to put it in a chat. So we're going to start off with self-care. Dr. Greenwood, what are some important things about self-care?
So one of the things that I focus on with my patients at work is before we can focus on managing any type of disease, whether it's diabetes, hypertension, cholesterol. Hypertension is high blood pressure. Before we can focus on that, we first need to focus on ourselves. And so I'll just give you an example. So I had a 49-year-old woman come into my office a couple weeks ago, and she just wasn't interested. She was busy, caught up with her government job. She's married, she has children, and we, especially women, we get so caught up in taking care of everyone but ourselves. And then she ended up getting in a car accident. And so it was recently, just yesterday, I talked to her on the phone, and I didn't want to say it, but I was like, I'm so happy. I was just congratulating her on now that she's sitting home and actually able to take care of herself and focus on herself, that she is actually embracing and taking heed to like taking care of her health and getting educated and working with me on getting her back controlled. And she was like, sometimes God does things for a reason.
Yes, he do.
And I didn't want to say that to her, but I was like, you're absolutely right. Because of course we have to be careful in the workplace. But that's what I said when she first told me she was in a car accident, that self-care is important. You need to slow down. You need to take care of yourself. Go to the doctor. The only reason why she ended up in my office was because she wanted to get dental work. Her blood pressure was so high, they wouldn't do dental work for her. So she came into my office, and I prescribed her some medication because she hadn't been taking medication because most people were scared to go to the doctors during the pandemic. Mm-hmm. She had stopped taking her blood pressure medication. So none of the providers was available. So they sent her to me, and I was able to prescribe her medication. But even still, with that happening to her, it took her 2 months up until the accident for her to say, you know what? I'm going to take care of myself. And so a part of managing diseases and making sure that you don't end up dying from these complications is self-care. You have to first appreciate yourself, take care of yourself, to take the time out. Go to the doctor, male, female, if you're listening, go to the doctor.
Self-awareness, yes.
Mm-hmm. Okay.
The next I want to talk a little bit about diabetes. I know that you stated about that in your introduction, but can you share with us some of what the warning signs could be for diabetes?
So first, before I go over again, like diabetes, because that's like my niche. I love educating on diabetes. That's a big issue in the African American community. Diabetes. We suffer from the complications the most. One, back to self-care. We're so busy trying to take care of everyone else, especially like the women. But two, we're not educated. We don't know what to look for. And so when they have different types of diabetes, some patients are born with it, which is type 1. Some patients end up getting it later on in life, which they call type 2 diabetes, which is sedentary. And so usually type 2 is what I'm going to focus on today, because that's usually what affects us later in life. And what I'm learning is before, many years ago, like 15 years ago, it could affect you as early as in your 40s.
So you said that there are several types of diabetes, and what was those types?
So they have two types, two main types. They have another type called gestational, but that's the one you get during pregnancy.
Okay, I've heard of that one before.
So type 1 is when you're born with it, when your pancreas, which makes the insulin, is not producing. So that's type 1. So that's hereditary. You're born with it.
Okay.
Type 2 is sedentary. So that's lifestyle. That's based on your diet, lack of physical activity, and most often still hereditary. So if we have like a family line of getting type 2 diabetes later on in life, you could be predisposed to it.
Okay. That's very informative. I didn't know that. I only heard of the one while pregnant. So the 2 types, that's very informative. Okay.
And so with type 2 diabetes, again, as I mentioned, like you can get it. It's oftentimes you get diagnosed because 1, you don't exercise. 2, you're eating garbage. So you're just eating whatever, you're not exercising. So what you put in is staying in. 3, race, African American, we're predisposed to it, which means hereditary, whatever is in our genes, we're more likely to get diabetes and suffer from it than another race.
Wow. Okay.
And then the third thing is, so I talked about diet, I talked about physical activity, and then I talked about your the hereditary. So that's the third thing. Okay. Can you explain the difference of type 1 and type 2 for my daughter? Okay. So I'll do it one more time. So type 1 diabetes, typically you're born with it. It's your pancreas is not producing enough insulin. And insulin is the hormone that is in our body that's being produced. So when you eat, your pancreas, which is the organ that produces the insulin, it releases the insulin and it helps take the sugar out of the bloodstream and store it in your muscles, your tissues, and your other organs where it needs to go. And so usually type 1, you're born with it. Your body is not producing it. They have all these different tests that they run. Type 2 diabetes typically used to come later on in life, but what I'm learning is a lot of my friends have been diagnosed in their 30s, 20 late.
Okay.
That's why this is important to me, because I have friends who are on 2 and 3 medications to manage diabetes, because we're sitting down more. School is sitting down. We're not out. We're not walking. We're not taking care of ourselves. And so type 2 used to be 40 years and up. But what we're learning is that now you can be I have friends, like I said, now being diagnosed with type 2 diabetes as early as their late 20s.
And these would be situations where it's not hereditary. This is from their lifestyle. So we're not getting enough exercise from working from home and things of that nature.
And your diet. So it's mostly affected by your diet and exercise. That's typically, because usually if they change their diet and if they increase their physical activity, then most likely you could manage it without medication.
Okay.
And the other thing about gestational, which is the type of diabetes you get during pregnancy, oftentimes it goes away after pregnancy, but now you're at a higher risk of developing type 2 diabetes later on.
Okay. So once you get diabetes, is it something that you can get rid of through the medication, or is it pretty much something that if you pick up that you will be fighting for the rest of your life on?
Okay. So oftentimes you hear like doctors like Dr. Oz say, or people come out and say, we have this cure for diabetes. Diabetes, like I said, so for type 2, what's happening in your body is either not producing enough insulin, which is the hormone that takes the sugar out and put it where it needs to go, or it's not using the insulin properly.
Okay.
And so the cells that produce the insulin, oftentimes those cells die off. So the science behind it says that once you have diabetes, you will always have it. You can manage it with diet and lifestyle in the beginning, but it's a progressive disease, which means as you get older, as your body begin to decline, that at some point you may need insulin. So we will have to inject you with insulin, because that's ultimately what you would need. And so it can be managed with medication. If you're younger, we try our best to manage it with medication. You're welcome. But if you're younger, we try to get you to first focus on diet and lifestyle. So diet means lowering your carb intake and your sugar intake. And so since I'm there, I want to talk about nutrition. I know that's on your list.
Yes. So nutrition is actually the next item on my list.
Okay. So since we're talking about diet and how to manage it, that's usually the first two areas we focus on. So there's the triangle. We have the medication, we have diet, and then we have lifestyle, which is increased physical activity. So when you're first diagnosed, depending on when you're diagnosed and depending on your numbers, and I'll go over what those numbers look like. But we focus on the first two parts of the triangle, the increased physical activity and then a diet, which is low in carbs.
And I definitely would like to see that that triangle, that the pyramid that you're speaking of. And I would also like to share it with my tea sippers. So if anyone is interested in receiving that information, I know for me, I'm more visual, so I would like to get a copy, and we'll try to see if we can get that to you from Dr. Greenwood as well. If you would like to have a copy or more information on diabetes, please make sure you send your request to me at Parthenia, P as in Paul, ARY, T as in Tom, HINA 302 at gmail.com. Again, that's Parthenia 302 at gmail.com if you would like to get some literature on any of these things that Dr. Tamika Greenwood is sharing with us today. Okay.
Back to me. I like that commercial break. Thank you. I get to sip on my tea. So, and I do have all of this information in layman's terms. I've created a packet for my patients so that way you can take it home. You can read it. You can explain it to your family. And so moving to nutrition, when we talk about nutrition, I don't specialize in nutrition. I don't specialize in nutrition. So I usually typically always refer my patient out. And if you are diagnosed, your doctor will send you to a nutritionist, because I like for people to go to the specialist. That person spent however many years learning about nutrition. So I oftentimes recommend you go to them. And of course, always go and look up additional information. What I'm giving you here today is basic information based on my knowledge and what I've studied. But there's a wealth of information on everything I'm giving you today that's out there. You can even Google it. But as far as nutrition, I'm a little more stricter with patients now, and I follow it myself. And so with nutrition, we focus on carbs. So if you're looking at a nutrition label, and I wish I would have brought it up here today, but if you're looking at a nutrition label, the area for diabetes that we focus on is the carbohydrates. And under carbohydrates, you'll see sugars. And so if you want to, if you know you have a family history of diabetes, and you want to kind of delay the progression or delay you actually developing diabetes, you can follow this, or you can schedule an appointment with a nutritionist, or you can talk to like a health fitness coach so they can guide you through this. But I typically use the lower end of carbs you can have per day. So there's a certain amount of carbs on that food label that you can have per day. And so it says you can have anywhere from, I'm going to do breakfast, lunch, and dinner, and then you can have 2 snacks per day. Right.
Oh, okay.
And so for breakfast, they say you can have anywhere between 45 and 75 grams of carbs.
Okay.
I always tell my patients stick to the lower end, which is 45 grams. For your snack in between breakfast and lunch, I usually tell my patients that they say you can have between 15 and 30 grams. I try to stay at the 20 grams.
Okay.
Mm-hmm. Excuse me. And then for lunch, same thing as breakfast, you can have the 45 grams. You can go up to 75, but I would probably stick to the 45 grams.
Okay.
And then for the snack in between lunch and dinner, you can get the 20 grams again, anywhere between 15 and 30, but I usually stick to the 20 grams. And then lastly, for dinner, because you're about to go to sleep, that's a little bit higher. You can go up to 90 grams of carbs in that meal. And so I usually stick to about 60, but 90 grams is what you can go up to for your dinner meal.
So when we talk about nutrition, say that I'm only 5'6", 120 pounds.
Mm-hmm.
Would there be any reason for me to go see a nutritionist if I had that perfect body?
So everyone can have a perfect body. And so having a perfect body, being a certain height, being a certain way. So yes, they have what they call the BMI scale, which looks at your height and your weight, which determines how much you should be, and your BMI should be this amount, or else you'll be at a higher risk for getting like diabetes and hypertension. But it doesn't really fit well in the African American community because we are naturally thicker. And so what I typically say is, so a couple years ago when I was living in Delaware, one thing that can predispose you to diabetes is having more fat around your stomach area.
I always said that. I always had issues around that holding that in that little middle pocket. Okay.
And so the reason why that is because with more fat in this area, your stomach area, it decreases your sensitivity to insulin.
So I can have it in my thighs. I mean, a little bit more safer than in my stomach.
Absolutely. So looking like a pear, versus having, because it pairs all that fat around your midsection. That increases your risk for diabetes. And so I was actually pre-diabetic when I was in my mid-20s because I wasn't watching my diet, I wasn't exercising, and my stomach area was a little larger. And so pre-diabetes numbers it usually starts. So when you get your labs, if you want to look at this, in every lab they have different ranges, but I'm gonna give you what the basic information is, the most common information. So my A1C, and I'm gonna talk about, this is the lab that they test you to see if you either pre-diabetic or have diabetes, or where you are once you're diagnosed with diabetes. And so the A1C lab is what you look for, the hemoglobin A1C lab. And so typically, if your A1C, so it's the average blood sugar that's attached to your red blood cells over the past 3 months. So you can't fast for this lab. It doesn't matter if you fast. And so if your number is high, this means over the last 3 months, your number was high. This is the average. Because our red blood cells die every 120 days roundabout. So we check this lab like every 90 days if you're at risk, or if you already been diagnosed, that's what we do. We'll check you every 90 days. And so my A1C, my average blood sugar over the past 3 months at that time came back at 5.7. What 5.7 means that I am now pre-diabetic.
Wow.
And so, of course, I went ham and I went in because I'm educated, I'm knowledgeable, like I have this knowledge. There's no way I should be.
Know better.
I know better. So, but that also showed me that I'm predisposed to, remember I told you my grandmother died from complications at 54. So me being in my mid-20s, I now have a pre-diabetes numbers. That means that at some point in my life, if I don't change my habits right now and increase my physical activity and change my diet, that I will be diagnosed with diabetes. And I was not going down that road.
Wow.
And so 5.7 to 6.3% A1C is pre-diabetes. So if you look at your labs at home, if you have them, or if you go to your doctor and they say, we're going to run your labs for the year, you ask them about your hemoglobin A1C, and if you see it's between 5.7 and 6.3, that is considered pre-diabetes. You are at risk for developing full-blown diabetes. Once you have the diabetes, once you're diagnosed with diabetes, which means you have had a 6.4% and above, then you will always have the diagnosis of diabetes.
Wow.
Because remember, I told you diabetes is progressive. It doesn't go away. It could be managed with diet and exercise as long as you can exercise and monitor your diet. But at some point you may need medication, especially once you get like in your 70s. I've seen patients been able to manage it for years with diet and exercise, and now they need medication.
Wow. Okay. So someone just came in, sent information on something they want to discuss. Before I get to that, because time gets away from us so fast in this beautiful 30 minutes. I wanted you to talk a little bit about exercise.
Right.
We do have to be a little bit mindful of time. And then I have something really good that came in from one of my sippers that they want to get questions or get answers to. Okay. So can you talk a little bit about exercise?
Okay. So
did you want to go here? Okay.
No, so I'm not going to talk about those two things, but exercise. So to wrap up diabetes, I'll just mention these two things and how it can be effective. But to wrap up diabetes, just to give you the first initial closing. So for exercise, the part of the triangle that I talked about that's important, we are supposed to do a minimum of 30 minutes of intense physical activity, if you can, a day. Wow. Minimum 5 days a week. So the recommendation is 150 minutes per week.
Wow. Okay. So that 3 days is not enough.
So 3 days, 90 minutes is enough.
Okay.
And if it's intense, it's intense. Now, if you are older listening to this call, they have different guidelines depending on your age and other health issues that you may be experiencing. But if you are younger, you are physically active, you can move around, you can dance, and you can do whatever, then the recommendation is 50 minutes. It's 150 minutes per week. That's 30 minutes at least 5 days per week that they want us to be physically active. Okay. And so it's not easy. I usually tell patients to start off with 10 minutes a day.
Okay.
For those patients who have diabetes, they can see the difference in their numbers when they exercise. Because remember, when you exercise, you're burning off the extra sugar, the extra fat, the extra calories.
That's how
you burn it all.
From a doctor.
Right. Okay. So burning it all. So I always tell you, go exercise. They don't tell you, recommend that you exercise after you eat because you're usually more hungry. But if you know that you ate a little bit more, then go walking. Don't just sit on the couch, because then that increases your risk for diabetes if you don't already have it. And then that makes the diabetes worse if you do have it.
Oh, wow.
So exercising 150 minutes per week. 30 minutes per day.
Minutes?
Mm-hmm.
Okay.
30
I'm
minutes
going
per
to definitely
day.
try to stick to this. 150 minutes a week.
Mm-hmm.
Now, is walking considered exercising?
So what we consider, if walking, for instance, if you have some pain issues, back issues, leg issues, feet issues, then any type of movement we consider is better than none. And so, but when I say exercise, we mean get your heart rate up.
Okay, so like a fast paced walk.
Fast paced, like
fast paced walk.
Exactly, like jogging if you can.
Okay.
But fast paced because you want to sweat, you want your heart rate to get up. So when we say exercise, we're talking about getting your heart rate up. You know that you're moving, your body is moving, and it's good for the next thing that's on your list for cholesterol, because if you've been diagnosed with high cholesterol, bad cholesterol, increasing your physical activity can increase the good cholesterol that's in your system. We could probably talk about cholesterol and blood pressure another day, but it's exercise. It works for everything, for your heart, for cholesterol, for blood pressure, for diabetes. And so exercising that 30 minutes a day is a key. And diet, exactly. Okay. That's why we always focus on lifestyle. So diet and exercise fall under lifestyle.
So again, the tea sipper wanted to know, is there any signs that you can let us know from your area of expertise for someone having a stroke? Like, is there any signs? Because I know we talk about heart disease. I know that has something to do with strokes. I'm not sure if diabetes could affect someone having a stroke at all. But is there any warning signs? I know I've heard people talk about warning signs that comes along with a stroke. Is there anything that you can help us with to touch on that subject a little bit?
Yes, so I will touch on that, the signs of a stroke, and there's actually a really cute video on YouTube.
Okay.
It's a nice video on YouTube, which you can actually even show your children, that goes over the signs of a stroke. But before we do that, let's go over the quick signs of diabetes. So for instance, if you haven't been diagnosed with diabetes, let me tell you some of the signs to look out for. And then I'll move into the stroke question. So some of the key signs that you want to look out for if you find yourself urinating more often. So if you find yourself peeing a lot and you know that that's not a normal thing, don't think because you're drinking water because you feel thirsty, because increased thirst is also a side effect. So if you know that you wasn't a water drinker and all of a sudden now your mouth is dry and it feel like cotton and you want to keep drinking water, and then now you go into the bathroom urinating a lot, you may try to say, oh, I'm only using the bathroom a lot because I'm drinking a lot. But what's happening is your body is trying to flush out that extra sugar. And so your body and your body is dehydrated. So it's going to have you increase in thirst. It's going to make you want to drink a lot, which is going to cause you're going to think that's causing you to pee. But peeing is also a side effect of like increased urination is also a side effect of having diabetes. The other thing is blurred vision. A lot of patients don't put two and two together. Oh, my eyes is just getting bad. No, ma'am. No, sir.
Yeah, I was just saying that I think my eyes are getting bad. Like, it's hard for me to read, like, after getting off the computer. So.
Well, that's different.
Oh, okay.
But a patient with diabetes, they will say, oh, my eyes, you have to have multiple symptoms. It's not going to just be eyes getting bad. Okay. Yeah, so you would have the increase. Most of the patients have the increased urination, which is peeing a lot. They have the increased thirst, so you feel like you're extremely thirsty. The other part is blurred vision. A lot of patients, and then they think, oh, I'm getting older, my eyes are getting bad. Absolutely not. Diabetes can affect the smaller vessels in your eyes, and it can lead to blindness. And also with you urinating a lot, it can lead to kidney damage, which you can end up on the road of dialysis, what I tell my patients. Okay. The other thing that diabetes can do, as far as the signs is, so I talked about urination, hunger. So you may feel like you're always hungry.
Okay. Someone had a really important question. Is this something the doctor checks for when you have your regular labs?
Absolutely. Okay. So when you have your regular labs, you have your CMP lab or your BNP lab. So that looks at your electrolytes. They look at your kidney function, and on there they tell you to fast because there's a glucose lab in there. So it will say glucose on your CMP, which is your chemistry panel, or your BNP, which is your basal metabolic panel, I think. I can't think of the name right now, but either one of those will show your kidney function. And on there, what you want to look at is your glucose. So if your glucose come back fasting and you're not diagnosed with diabetes above 100, then they will test you for A1C. Okay. And the A1C is the lab that they use to test that looks at your average blood sugar over the past 3 months. They will also look at all those symptoms. They'll go deeper, so they'll do that extra lab. But oftentimes, I mean, they've been checking my A1C since I was in my 20s, so I'm pretty sure that the hemoglobin A1C is like a natural lab that they check. It's one of those common labs that they check during a physical.
Yeah, because I know, like, I go to Kaiser and they check all of those things. I don't know if it's because I'm on a fluid pill to control my blood pressure. I'm not sure if that's why, but I just saved my labs over the years and I compare them. So even if I'm not in a risk, I still see my areas of opportunity. Like right now, my stuff is off the chart. I know it's due to weight. So that's why I did the cleansing, no meat and all those types of things. So that's very interesting.
Right. All right. And I think I covered, so increase thirst, increased urination, blurred vision, and increased hunger are like the top symptoms. Some patients actually feel, no, that's for low blood sugar. So those are the most common symptoms for high blood sugar. And if you notice any of these signs in yourself or in a friend or a coworker, you tell them you need to go to the doctor and get checked out. Don't just ignore them.
And encourage people. Let me just say, of course, I'm not a doctor by profession, but I like to take on a lot of trades. But it's very important that you encourage one another, because you may know someone who is not going to doctors. I know for times men, I don't know how they are now, but I know years ago men wouldn't go to the doctors as often. So women have to kind of be the encouraging one. So if you know a male, your spouse, your son, your dad, brother, make sure it's very important that they're getting tested, because sometimes we don't think anything's wrong with us until we find something wrong. And I've had several friends that didn't know that they were sick until they actually went to the emergency room with what they thought was a minor problem, and it was more than that.
Right. Which leads us into exactly it's deeper. I mean, the complications of diabetes. So long-term complications. So immediate complications is what I just talked about. But long-term though is dialysis. So you talked about stroke. So if you have if you have diabetes, once you reach 40, your 10-year risk, if you're not on a certain medication like a cholesterol medication, increases. So we look at your heart risk for having a stroke or heart attack. So your risk doubles, almost triples, especially if you're African American, if you have diabetes. So you're definitely predisposed, which means that you're more likely to have a stroke and you're more likely to have a heart attack if you have diabetes. And that's where we'll talk about cholesterol and blood pressure later. And then adding on those two, increases that risk even higher. And so absolutely. And then with men not going, I always make jokes and I tell, especially like my siblings, that you better be careful how much alcohol you drink, because alcohol turns into sugar. And if you end up with diabetes, your penis isn't going to work. And most people
I heard someone say that. I thought it was a joke.
No, that's not a joke.
Man, do you hear that?
Your penis is
watch the amount of alcohol you take in, because the alcohol can stop your penis from working.
Not just that though, because I'm using alcohol as an example, because I know most guys drink. Not most guys. I know the guys that I told.
Some guys drink.
Some guys drink, like my brother. I told him that.
Oh gosh, I done heard the penis and the alcohol and just went with it.
Okay, no. That was just an example.
That
was just an example of like having diabetes or having hypertension. Like it does affect your genitals. Like it does affect your sexuality. So I have some 45, 50-year-old men coming into my clinic who was like, coming into the clinic saying, I would rather have high blood pressure and die from a heart attack or die from a stroke than to take medicine that's going to stop me from being able to have sex with my wife. And so that's what I hear men say, or I'll get an African-American man coming into the clinic saying, my blood pressure always high. I said, well, not with me. And so I get them on track. And almost 90% of the time, especially since I'm in at my current site, they're able to get their blood pressure under control and they're doing much better with their health. But it just takes us, one person, to say, look, I'm not going to allow you to die from something that's preventable.
Right.
And so stroke, as I mentioned before, you are at a higher risk for stroke. So some of the signs for stroke that I can recall off the top of my head, the number one sign that we notice from the person is like, slurred vision. So the slurred speech, slurred speech. Right. And so their words will end up becoming jumbled. And then they have what you call a stroke. And then they have something that's called a TIA, which is a transit stroke. So it's like a pre-stroke. So sometimes they say patients had warnings. Most of the time, a patient probably had like a small minor stroke, which means that it didn't take them out or didn't paralyze them. And typically when you have that minor stroke, that TIA, which is transient, they usually put you on something like an aspirin or something to prevent you, or cholesterol medication. They try to manage your blood pressure, which are some of the things that we do to help prevent you from having a stroke, manage your diabetes. And so all of those areas with medication we can manage to prevent you from having a stroke. But so slurred speech is like the number one sign. Droopy face is another one. And so the face, slurred speech, you'll see their face will be lopsided. That's another one. Weakness, either left or right side. So typically it's mostly on the left side. So if a patient have a stroke on the left side, if they're paralyzed on the left side, that means that they had a stroke on the right side of their brain.
Okay,
it's the opposite. If they're paralyzed on the right side, that means that they had a stroke on the left side of their brain. But there's a really cute video on the stroke. So, paralyzed, so feeling weakness, numbness on any side of the arm, on any side of the body, slurred speech, words are jumbled, so their speech will also be jumbled. And I think the video say it's time to call 911. And so show it to your children. You should watch it to learn the signs. It's a really good video that I was showing to like kids when I was working in Delaware. So that way kids can learn it, they'll sing it, and if they see it happening to you or anyone in your family, they know to call 911. So the biggest thing with having a stroke is getting the patient to the hospital as soon as possible, because they have two different types of stroke. Once you actually have a real stroke, they have the one that's called a hemorrhagic stroke, which means that you have a bleed in the brain, a bleed in the brain. And they have one that's called an ischemic stroke, which means that wherever you had the stroke, so the brain wasn't getting enough oxygen. So those are the two different types of strokes. And with the bleed in the brain, both of them need attention right away. But with the bleed in the brain, the therapy that they give them have to be given within a certain window. So if you don't get them there soon enough, then they won't be able to get that therapy. Wow. And in a long-term effect, the likelihood of them surviving is very slim, very, very slim. So the most common type of stroke which you see people survive is the ischemic stroke. And typically that comes from not managing your blood pressure, not managing your diabetes, having high cholesterol, not taking your medication. Stress can lead to, which increases blood pressure. So there's several different things. It's preventable though. We can prevent it by managing these different disease states and taking self-care, back to self-care, taking care of ourselves.
Well, we are definitely over our 30 minutes, but we definitely want to say thank you, Dr. Tamika Greenwood, for sharing some very important information. If there's anyone on here and you have an expertise in a particular area, or if it's something you want to share, it could be about cars. It may be a man on here that knows a lot about cars, and he may want to share a session to help some of us females stop being wiggled out of our money. So if anyone have anything they're willing to share, you can even come to me or I can come to you. Just make sure you have me some tea ready. So again, thank you for your time today. Again, thank you for all my sippers. It's a pleasure to have you. And I just want to say thank you so much for sipping with a sister.
Thank you for letting a sister sip.
Have a great day.
Bye, everyone. Thank you. That was so awesome.
Yes, it was.